health is wealth. Louis Pasteur, a French scientist, showed that particular types of microorganisms, microbes or germs cause certain diseases. Disease is a condition which means lack of ease or comfort. Some of the body processes start malfunctioning, which also affect the overall well-being of the body. Types of diseases. Diseases can be classified as communicable diseases and non-communicable diseases. Communicable diseases are those that can spread from one person to another. Most of these diseases are caused by certain types of pathogens or germs. These are also called infectious or contagious diseases. Non-communicable diseases do not spread from one person to another. These diseases are not caused by pathogens, but by other factors such as improper diet, improper functioning of certain organs, exposure to harmful chemicals, etc., or through heredity. Communicable diseases. Causative agents or pathogens. Most communicable diseases are caused by bacteria, fungi, viruses, and protozoa. Microscopic organism. Bacteria. Some of the bacterial diseases are dysentery, cholera, diphtheria, food poisoning, pneumonia, tetanus, tuberculosis or TB, typhoid, plague, and whooping cough. Fungi. These are plant-like microbes. Some of them cause skin diseases such as athlete's foot and ringworm. Viruses. They are so small that we need a special kind of microscope called electron microscope to see them. Different types of viruses cause various deadly diseases. Some viral diseases are AIDS, chickenpox, common cold, German measles, hepatitis or jaundice, influenza or flu, measles, mumps, rabies, and smallpox. Protozoa. These are microscopic animals. They are made up of a single cell. Different protozoa cause different diseases such as amoebic dysentery, malaria, and sleeping sickness. Other causative agents. Many worms like the pinworm, tapeworm, etc., and small animals like itch mites also cause several diseases and infections. Spread of communicable diseases. Some non-living agents such as air, water, food, clothes, and vessels used by infected persons carry germs and spread them around in the environment. Communicable diseases can be classified according to the way they spread. Diseases that spread through air. The air around a person infected with certain diseases such as chickenpox, diphtheria, German measles, mumps, tuberculosis, or TB contains germs of the diseases. This is because the person may transfer some germs to the air when he or she breathes out, coughs, sneezes, or spits. The infected air carries the germs to healthy persons and infects them too. Thus, these diseases are spread by air and hence called airborne diseases. Control of airborne diseases. Everyone must cover their nose and mouth while coughing or sneezing. A patient must use a spittoon with a cover if he or she needs to spit. Some disinfectant must be poured in the spittoon. Nasal discharges, vomit, stool, and scabs that fall off from patients suffering from chickenpox, etc., must be disinfected if the patient suffers from airborne diseases. All personal items such as handkerchiefs, clothes, bed sheets, etc., must be disinfected before they go for washing. This is to be followed in case of all types of communicable diseases. Diseases that spread through water. Germs of some diseases such as cholera, diarrhea, dysentery, gastroenteritis, jaundice, that is hepatitis, and typhoid spread through contaminated water. These diseases are called water-borne diseases. Food, milk, and water that contain germs are said to be contaminated. Control of water-borne diseases. Water-borne diseases are more prevalent at the times of rain, as water bodies get contaminated due to washed-off dirt and land pollutants. The situation gets aggravated in areas with poor drainage. Drinking only boiled water or water that is purified by a water purifying machine can keep us safe from water-borne diseases. Water supplying authorities add chlorine to water, as chlorine kills germs present in the water. It is best to prevent water from being contaminated by maintaining hygiene close to water bodies like rivers, streams, lake, ponds, and wells. Diseases that spread through food. Due to ignorance, negligence, or unhygienic habits of patients and food handlers, food can get contaminated and cause diseases. Stale food or food prepared, stored, or served in contaminated vessels can spread diseases. Plates, spoons, etc. used by patients must be sterilized. Sterilization is a method used for killing germs. Diseases that spread through clothes. Clothes, bed sheets, napkins, combs, foodwares, etc. used by patients carry pathogens. Hence, using personal articles belonging to others is not right. Diseases that spread through direct contact. We know that infected people carry pathogens or germs, possibly on their skin, hands, etc. Any direct contact with them can result in infection. whooping cough,
and chickenpox spread by direct contact. Maintaining general cleanliness and hygiene, disinfecting patients' clothes, utensils, and bed sheets, and sterilizing disposable syringes, gloves, and other medical objects are a few ways to prevent diseases spread through physical contact.
Health is wealth. Diseases that spread through injured skin. The skin is a natural barrier that prevents germs from entering the body easily. If it is cut or injured, germs or even certain type of worms can enter our body through wound. Bacteria which cause deadly diseases such as tetanus sometimes enter the body if an old rusty nail, a sharp stone, or a glass piece or a sharp knife injures us. Any cut on the skin must be washed well with clean water and soap and covered with a sterile bandage after applying some antiseptic cream or liquid. This will kill the pathogens around the wound and minimize the risk of an infection. An anti-tetanus injection must be taken as a precaution. Diseases that spread through bites of animals. Bites or scratches by any rabid animal can give rabies. All bites and scratches, including those by human beings, should be treated by a doctor at the earliest and without fail. Bites by centipedes, snakes, even non-venomous, rats, cockroaches, and stings of bees, scorpions, etc. must be medically treated. Diseases that spread through vectors. Certain animals, especially certain insects, carry germs of specific diseases from one person to another. Such organisms are called vectors. Malaria, filariasis, and dengue are caused by mosquitoes. Plague by rat flea. Sleeping sickness by a type of fly. And typhus is caused by body lice. General preventive measures. Some preventive methods are: follow the rules of good health and hygiene. Keep your nails short. Wash your hands with soap and water after visiting a toilet. Take a proper bath every day. Consume wholesome food and drink clean water. Play games, do regular exercise, and take enough rest. All these measures build body resistance. Get yourself inoculated when required. Many communicable diseases are avoided by getting inoculated against specific diseases, especially when the risk is high. For example, during floods and epidemics, or when visiting an overcrowded area, like melas, yatras, etc., where the standard of hygiene is low. Vaccines are available against cholera, diphtheria, German measles, that is rubella, hepatitis, measles, mumps, polio, rabies, smallpox, tetanus, tuberculosis, typhoid, and whooping cough. Use a mosquito repellent or sleep under a mosquito curtain. Dispose of all wastewater in a hygienic manner. Stored water should be covered to prevent mosquito breeding. Non-communicable diseases. Non-communicable diseases are those that are not caused by germs but due to functional disorders in the body or due to deficiency of certain vitamins or minerals. Diseases due to functional disorders. These diseases occur when a certain part of the body does not function properly. Diabetes, blood pressure, heart failure, paralysis are some examples. All these need medical attention. Deficiency diseases. These diseases occur due to the deficiency of certain vitamins or minerals or even water. Treatment of these diseases consists of consuming food substances rich in these nutrients and thereafter having a balanced diet. Severe cases of any deficiency disease need immediate medical attention. A severe deficiency of proteins in children causes kwashiorkor.
Some deficiency diseases and their causes are: anemia is caused due to deficiency of iron, a mineral. Goiter is caused due to deficiency of iodine, a mineral. Rickets is caused due to deficiency of calcium and phosphorus, which are minerals, and also due to deficiency of vitamin D. Beriberi is caused due to deficiency of vitamin B1. Pellagra is caused due to deficiency of vitamin B3. Scurvy is caused due to deficiency of vitamin C. Night blindness is caused due to deficiency of vitamin A. Kwashiorkor is caused due to deficiency of proteins in children. Dehydration is caused due to deficiency of water, minerals, and sugar.
Severe dehydration can kill a person. So, never neglect it.
Dehydration takes place when there is a loss of water from the body due to severe diarrhea, vomiting, or heavy perspiration.
It can be treated by frequently drinking water containing a pinch of table salt, a spoonful of sugar, and a few drops of lemon juice. The affected person should sit or lie down and take rest. Severe dehydration needs urgent medical care. Hereditary diseases. Diseases or disorders that are passed on from one generation to another are called hereditary diseases. Such a disease is present from birth, and each disease has its age of expression. Some hereditary diseases are Huntington's disease, sickle cell anemia, and hemophilia. Some diseases are caused by environmental factors and unhealthy lifestyle. Asthma, inflammatory bowel disorders, general learning disabilities, and some cancers are also seen to have a greater probability of occurrence in older family members.